Today I'm interviewing Christine. She's a nurse at BioLife and an ER nurse at Stanford down in Fargo. So, why did you choose nursing?
I, even from a young age, always wanted to be a nurse. Always have been interested in health and healing, especially with the elderly, and then just giving them the best care possible.
So, why did you choose an ER nurse?
ER nursing, honestly, was something actually that I fell into. I always thought that I would end up in a different area. Um, I was working in an observation unit. Manager was the same. So can you cross train to the ER? I'm like, I guess. And went down there and just fell in love with it. Something different. You never know what you're going to get next. Could be somebody old, somebody young. Um, and you see so many different things and learn so many different things.
I've always thought the ER was interesting. So,
It is. It's amazing. So
what kind of education did you take to get here?
to get here, actually kind of went the long boat road. I was an LPN first, then I got my RN. I'm currently looking at BSN programs to finish off. I have also taken national certification exams, so I'm a certified emergency room nurse and a certified critical care nurse.
Interesting. So to be an ER nurse, you had to become certified in those
You
things?
do not have
You
to
don't?
become certified.
Okay.
It is just hospitals have something called magnet status. It's a American Nursing Association designation where it's just a hospital that nurses want to work at. They're given
Okay.
opportunities for education, and it's kind of, I don't know how to explain certification. It's like, because there's so many different areas now, if you ask me to deliver a baby, no.
Okay.
I don't do that. But I'm certified in emergent care.
Okay.
So
So if you wanted to, do most departments have you get?
you can get
Yes,
certified in
okay.
different departments. You could be a certified med surg nurse, certified OB.
Okay.
There's OR. There's not a whole bunch.
Yeah.
Med surg covers a lot,
Okay.
but emergency room has a lot too. So
I didn't know you could get different certifications.
you can
for
become a
things.
certified peds nurse.
That's
I actually have a
cool.
friend in Fargo. She's a certified emergency room nurse and a certified peds emergency room nurse.
That's really interesting.
They are hard
I bet.
exams. Hard exams.
I bet. Okay, so what is a typical day for you? Both at BioLife and then at Stanford in the ER.
A typical day for me at BioLife kind of consists of kind of reviewing our physical schedule. We look at letters for donor who have obtained healthcare letters from their providers, kind of get things ready for our center physician. We basically do mini medical screening and physical on potential donors. We also manage donor reactions to the plasmapheresis process. That pretty much is my job there in a nutshell. Emergency room, that's a little bit not quite as sedate. Kind of fly by the seat of your pants. Basically, a typical day there starts. You could either be out as the triage nurse or you could be staff nurse in your own pod. And really there, it's just a team effort and you're just kind of ready for whatever rolls in the door, whether it's a heart attack or a baby with a fever.
Okay. So a pod is you have.
We call
You
them.
explain those ones to me.
Yeah, we call them pods. So if you and I were in a pod together, we're nursing partners. There's usually 3 nurses. Basically, we share a group set of rooms, and we work with our own specific physician in that group. So you and I, we would have you be 7, 8, 9. I be 9, 10, and 11. We share room 9. Whoever has a lighter load can grab that third patient. And then if you need help, that is your partner person.
That sounds like a nice little system.
It is a nice system, and sometimes you have your 2 or 3 rooms are all full, and all of a sudden yours are all empty at once, and they bam, 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 bam. So I'll go in, you can do your assessment and your triage on that patient, and I'll put in lines and whatever, get them undressed, get them in a gown, and just get them settled faster for
Okay.
you.
That does sound really nice.
It is a good place to work.
So, as a soon-to-be possible nurse, what is the best advice you could give me when I go out into the field on my own?
The best advice to give you is, it's going to be so hard to say, is don't take things personally. And that sounds awful because it will be personal to you. You will not know everything. You are getting the basics. And just never think you're stupid. You're not. Just take every opportunity to learn. If you have a question, ask. And if you're working in an environment that doesn't welcome questions, find a different one.
Okay. So I know a lot of times you have that stereotypical in movies, doctors don't always appreciate nurses. Have you ever been in situations like that?
Absolutely. Definitely have been in
tough?
It's incredibly tough. It's incredibly tough, and it's incredibly hard. And that was one of the things I enjoyed about in the ER is their department chair at one time, and this was prior to me even starting there, their department chair and their nursing manager sat down and said, we can't continue with this. I'm here as the physician, you're here as the nurse. This is a team, and that is something that Sanford and Fargo kind of pushes, period. They do not have physician parking.
Okay.
You can go park in the parking ramp with the employee, and right next to you, the trauma surgeon's getting out. There's no
real division.
There's no distinction of rank.
Okay. Because you always see in movies how there's such a huge distinction in rank between nurses and doctors and other people.
And if you work at other places, say the one here in town, you will definitely see that. But where I worked, we kind of all sat together. I've had docs there help me boost patients.
That's nice.
It's just not a big deal.
Okay. So, how does microbiology relate to nursing?
Microbiology is a huge part of nursing. If you think of terms, and I'm sorry, I have to get on my soapbox here, as far as microbiology, and I probably have already said this to you before, the leading cause of death in the Civil War would have been what?
Isn't it MERS? No.
No, it was tetanus.
You haven't told me this.
Yes, it was actually tetanus. More soldiers died from tetany during the Civil War than gunshot wounds.
That's crazy.
Because a lot of people did not have shoes, and they were walking in the soil, and they had injured feet. And, at that time, we didn't know that tetanus, is through dirty soil, and that's how they died. Okay, so we're thinking of all these, they used to use this dirty equipment. And true, that does play a factor, but just a thing of, hey, washing your feet and keeping shoes on makes a huge difference. Nowadays, you really can see, as far as studies on hospital-acquired infections, the importance of hand washing, the importance of sterile technique when you're performing these things. And it's huge. And it's hard because there are a lot of people who will walk into a room and won't wash their hands. And you just can't imagine the impact. And if you think you're not dragging that into the next room or the room after that, it's a big deal. And one thing that I've noticed, and that I wish, really was everywhere, is when you work in critical care, you do not carry a stethoscope.
Okay.
Every patient
has their own. That's really cool.
And they are sterilized afterwards. However, that's only in critical care.
It would make sense if they kind of expanded that.
If you think about it logically, I'm one of those people, I try and wipe mine off, but I can't say I remember every time if I'm in a hurry. Do I run into the next room or do I run into the next, to do an assessment? Did I wipe it off?
Yeah.
And that was one of the things. I mean, I think that's huge, trying to keep organisms confined. That is one area I think, if you are coming into as an inpatient in the hospital and you're, pretty much everything now is moving towards private rooms. It should be private equipment, whether you're using disposable stethoscopes or you're using regular ones and having them autoclaved after.
Okay.
Is a very big deal.
That's really interesting.
Yeah.
Because I guess it's that little thing that you don't think about, how that could cause an infection in someone else if you used it on someone that had one.
Yeah, and you'll see a shift towards doctors going away from white coats because there was actually a study done that's saying them with their white doctor coats harbored more organisms on those coats.
Interesting.
From bending over beds, just a cuff, touching a patient laying in bed, and then going on to the next and the next and the next room.
I guess thinking back to my CNA experience, I've never seen a doctor wear a white coat at the hospital down in Phoenix. And that's really interesting.
Many of them don't.
Interesting.
So another area of improvement in microbiology is in terms of contact precautions, and you'll see this once you start working. They're not, the way they're implemented now, to me, is not logical. So you're in the hospital, you have an MRSA infection. When I, as your nurse, walk into that room, I have to gown, glove.
I've had to do that before.
Okay. But your sister's coming to visit you.
Don't they have to gown up?
No, she does not.
Interesting.
Then she can walk down the hall. She can go to the cafeteria. She can get coffee. She can use the bathroom after she's hugged you.
Interesting.
Given you a kiss. Not bother to sanitize her hands on the way out.
You would think that they would require you as someone who's visiting to gown up too.
They do not. Because families find it offensive.
Huh.
And then you run into the whole...
the
overall good versus patient satisfaction and price gaining scores.
Yeah. I know as a CNA, one time there's a guy that possibly had MRSA, and they hadn't put him in his own room yet or anything, but the nurses and the CNAs had to still wear the gowns and masks and gloves and everything, but the wife and the child didn't have to, and the mom decided to change the baby's diaper right on the bed, foot of the bed.
Yep.
And the nurses gave her a very long lecture about how that's not good for the baby.
It's not good for the baby, but unfortunately they all live in the same household. They're all carriers at that point.
Okay.
One person has MRSA in your house. I have it. My husband and son have it. The end. So they're all carriers. Whether they get a wound, develop a wound that cultures out for it, maybe yes, maybe no, but...
So if you were to have MRSA, and then since they have it, would they get treated?
They would not be prophylactically treated.
Okay.
They'd only be treated if they were symptomatic.
Okay. Interesting. I didn't know that.
Yeah.
Fun facts. What's the coolest thing you've seen in the ER?
Coolest or grossest?
Both.
Let's see. In terms of the hardest case I had was a 28-day-old baby with a malfunctioning brain shunt that went unresponsive. So that was the fastest run to the OR I've ever made. Grossest thing was probably a car accident in which they hit an overpass on the interstate.
Oh, goodness.
The engine was pushed into the cabin of the SUV. The legs came up and she snapped her femurs, and those were open fractures.
Ooh.
Ooh.
That sounds painful.
The saddest probably is nursing home patients that